Micronesia. The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage, with generations of Filipinos calling Guam home. KUAM presents a monthly look at the capital city featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by the Bank of Guam and KFC. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
It takes all of us to protect Guam. Join the Guam Visitors Bureau in our social media campaign series aimed to protect our island and each other in this COVID-19 era. Participate in the Protect Guam movement by wearing your mask, showcasing Guam's heroes, staying active, and downloading the Guam COVID Alert app. Post and share your content with us. Use the hashtag ProtectGuam, and you could win $100. It's that simple. Check out visitguam.com for details. Let's reclaim our lives, our economy, and our tourism industry.
Half a day in Mabuhay. I'm Ann Pobutsky. I'm the territorial epidemiologist for Guam. Wearing a face covering protects you and those around you. We know that COVID-19 can be spread by people who are not showing symptoms, which means they are asymptomatic. Because Guam remains at risk for significant community spread or transmission of the virus, it is a necessary precaution to wear a face covering when you are in public. Everyone must wear a face covering when they leave home, have it visible at all times, and put it on when they see others nearby. Face coverings are required for everyone when shopping at stores, seeking healthcare, and inside the workplace. Covering your face reduces the chance that you will unknowingly infect someone else if you are carrying COVID-19 but have no symptoms. Prevention saves lives. For more information, please call 311 or visit our website at dphss.guam.gov.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
I'm gone. So let me tell you about this girl, yeah, she's so fine, and every single day she's running through my mind. I just wanna call her mine, because your smile makes my day, and you take my pain away. Oh my darling, love me back, 'cause I'm gone, no more trying. I'm gone, I'm waiting for you.
Hey, good morning, Friday. What a beautiful day in the neighborhood. Coming to you all the way live from beautiful and scenic Harmon.
Hey, come on, man. Dude, power lines are very photogenic, man.
We got nice sky, I'll say that. It's 7:18. Let's head into the KWAM News Zoom room where Dave.
Nice shirt, Doc.
He's wearing his Island Wear Friday. Glad to see you got the memo, Doc. I didn't know you had Island Wear. It looks nice. Good job.
Yeah, thank you.
Good morning.
Good morning, everyone.
He's the Chief Medical Officer for Public Health Social Services, of course, Dr. Felix Cabrera. I guess, could we just start that thing I sent you about the 2 mask stuff that Fauci was talking about? Your thoughts on that, or should we start wearing 2 masks?
Well, I think first of all we have to recognize that that the attention came during the inauguration of President Joe Biden, and I don't know if you're standing out in that cold weather, you probably want 2 or 3 masks on, and so maybe that was their first motivation. But in all reality, is that it's basic common sense that the more layers you have on, the less likely particles are going to escape from your mouth and your nose. And so that's the first part there. I guess Dr. Fauci's been bringing it up more because of the concern for the strains that are more infectious.
The variants.
And so the way that we combat that is that we put more layers between us and those infectious COVID strains. And so, when we think about the different masks that we wear, right? So right now, the CDC doesn't recommend that you go out and get an N95, especially because of they are, really more for the healthcare professionals. But surgical masks are starting to become more readily available, and you can purchase them even in the grocery store. At least they're medical grade masks, I should say. And what we're seeing is with those masks, they're about 50% effective in protecting you and about 60 to 70% effective in protecting others. A regular cloth mask is anywhere, it's about 60% or so from protecting others. That's way better than nothing, right? You put the two together, you put a surgical mask, you put a cloth mask over that. Now you're talking about over 90% effectiveness in terms of reducing particle spread. And so that's where that comes from. And so, of course, there's a balance between your ability to breathe through those layers, the temperature. I guess we're in a major cold front right now here in Guam, so maybe some people are going to want to wear, both masks. And so, but I think that's the key part there, and that these loose-fitting like bandana type masks and everything, they really are probably not going to be very effective. I still think they're way better than nothing at all.
Yeah.
So there's a balance here. I don't want to start saying, that everyone must double mask, must double mask. I might be singing a different tone if it was very clear that the strain was running rampant here. But as of right now, it's something that if you feel more comfortable doing and you feel you can do that for prolonged periods, then please do, double mask, or at least have 2 to 3, more than just one layer, have 3 layers, and making sure that fabric is has enough protection. One good way that you can tell is get a lighter or a candle. If you can blow that candle out while you're wearing that mask, that is not a good mask.
Wow.
And so that's one way that you can quickly tell that.
Doc, with the variants, right? So I saw yesterday. It's in the Philippines. There's like a UK variant. It's kind of popping up everywhere, right? And it's really reminding me of when we first started hearing about COVID-19, and it went from it's popping up here, it's popping up there, here, there, everywhere, COVID. And then, lo and behold, it landed on Guam. So with these variant strains, are you confident that our quarantine is going to act as a kind of like a border wall, if you will, to keep the variant out? And how serious a threat do you think it is, these variants?
Well, I think that it is a serious threat. It definitely is. And right now, I think our quarantine process is very good. And, basically, in terms of we're almost the same as, for example, the CNMI, who've done a very, great job of protecting their borders. And in terms of how we quarantine, the one big difference that we have between Guam and the CNMI is that there are more exceptions for essential workers. And so they are required to have a negative test upon arrival, but then they're given restriction of movement, but they're still allowed to go to work and then but being in this restriction of movement. So those are areas where there is, we call it porous. And so we want to ensure that there's good accountability for that, and that we account for that in a way that, doesn't put us at more danger. What we're seeing right now is that more and more of our percentage of positives that we're seeing here, on a weekly basis is coming from the QFAC. And that's what exactly we want to see. We want to see where it's really the only positives we get are the ones we're catching at the border, and then the community testing is still going on at a high enough rate and where we're basically not finding many at all. So we're rising up toward that, toward that ratio, and that's what we want. And we don't want any more community spread.
Well, speaking of the QFAC, are you aware of those complaints that were made against certain nurses over at the QFAC?
I don't know the exact details, and so I'm not going to comment on that at all. And I know there's some question about whether on work hours or not, but I don't know much of that detail.
Okay, yeah, it's not just work hours; it's allegations of drinking on the job, not doing their job, not being on site. So
it's not in your lane, Doc.
Yeah.
Okay.
What else is going on here with the vaccinations? I know we're doing outreach testing, right?
Yeah, another outreach testing today at Tizen. And so we encourage everyone to, to take the advantage, take advantage of being able to go out there and still get free testing, because it's still a very important part of what we're doing to ensure that we don't have community spread. And, it's another way to help protect you and your family. So please go out there. It starts at, let me see. It's in Tizen. I just don't have the start time. I'm sorry.
I think it's 9 a.m., right? Is it 9 a.m.?
Yeah, typically it's 9 a.m., right? Yeah. And so we didn't have a big turnout yesterday. So, we really encourage everybody to go out and take advantage. But I want to talk about with the vaccines. So this is very preliminary results. So, but right now it appears that we may have vaccinated over 2,000 persons yesterday alone. And so that's an incredible number when you think about how many in one day. And that's, combined operations from all the different, avenues that you can go through to get vaccinated. And of course, a big one of that is the University of Guam Field House, which is a partnership with Public Health and the National Guard. And so we really encourage people to take advantage of these opportunities if you're eligible. And there's going to be an additional site tomorrow in Okadu again that Public Health will be running at the same time that UOG is still going to be running. And then, of course, the Southern Clinic as well will be running as well. So there's all these different opportunities, and we really encourage everyone to take advantage.
Do you guys keep track, though, of the number of people that are getting the vaccinations that aren't within the 1A, 1B, and 1C? Because we know for a fact that people are getting the vaccine that aren't in those eligibility criteria groups. So do you guys keep a track of that?
Absolutely.
Mm-hmm.
Yeah, no, they definitely have to be they have to fit into that criteria, and that's what's screened at the head, as they get in. Now, again, there are instances where we rather put a vaccine in the arm of somebody who doesn't meet the eligibility criteria than it go to waste. Mm-hmm. And so these are typically at the end. And we're talking about, onesies, twosies, threesies, here in the span of where we vaccinated close to 26,000 doses here. And so, keep that, in mind, and that's something that we want to ensure is really understood. And remember that we're drawing out more per vial. Like for example, the Pfizer, you're supposed to be only 5 doses per vial. We're drawing out 6. So we're getting additional doses as well. And we're like, okay, additional dose, don't want to waste that. And so that usually comes toward the end of the day.
But Doc, is there a protocol for announcing the availability of these extra vaccines? You know what I mean? Or is it just who you know? Come on down.
No, it's site specific also. And if there's what I understand is that based on where you're, on what clinic it is, and a mass vaccine clinic, they may have a list of those who are in the other agencies, GovGuam agencies that have their other tiers that they were holding back, so to speak. Like they're like for example, the police department, for example, they had their tier 1s where they were the ones that we really wanted to get vaccinated first. Those were those that had risk. And then tier 2, tier 3. So they had their list, and they kind of, they were on standby in those examples. But the one thing I wanted to really make sure I make sure that everybody understands here is that we are running, our vaccine supply is running low at this point. We are consuming, a fair amount of it, and that's a good thing. That's a really good thing that we should be very proud of. But at the same time, it's going to put us in a position where it doesn't. It's not a bad position, but those who are due for their dose in a certain week, for their second dose, it may have to be pushed out to a week after that, and that is okay. The CDC basically just is saying that yes, you want it close to your due date, 21 days for Pfizer, 28 days for Moderna, but for either brand, you can go up to 42 days and they have good data to show that that's okay, and that you'll still be just as effective as if you got it closer. What we don't have is after 42 days or 6 weeks where there's limited data, but the expectation that you're still going to be okay. So what we don't want is people freaking out when they say, oh my God, my dose is due this, this exact day, but then you're getting reminder calls to saying it would be best if you go to this clinic on this day, which might be the week after. And so we want to make sure that we set that expectation and that it's okay and that we'll get to you in a timely manner. And if we're pushing toward that 42 days, you are going to be the priority, absolutely. And I really commend those that have gotten their first dose. We have about a 93% to 96% compliance in them coming back and getting their second dose. That's really impressive. I didn't think it was going to be that high. And we're talking about just a few plus or minus 2 days. So people are being very good about it. I don't want to discourage them and say that, oh, now we're going to push it a week out, but just want them to know that we appreciate that. And it's okay if it's going to be delayed by a little bit because you're still in that golden window.
We do have a follow-up question regarding when I'll just ask it. Should unassigned people wait at the site for the extra vaccinations?
Right.
I can't really answer that because the reality is that there are many days where there is no extra dose.
Right.
That they actually are able to, that they know that there's 6 people left in the line, and then they get one vial and they draw out those 6 doses, and then that's it. And so there's not those, there isn't going to be that 1 or 2 doses that are going to be left. So
but I'll just say,
I
Doc,
don't necessarily recommend that.
Anecdotally, just from personal experience, a friend of mine was at, I want to say Ukadu, just escorting some elderly, and it was towards the end of the vaccination day. And this person had made a joke like, oh, if you guys have extra, give me the shot. And it was like, oh, yeah, we actually do have extra. Come get the shot. So you see what's happening here is people are going to hear about this and they're going to turn it into you got to be connected. You got to be in to get the vaccine now if you're not in the priority group. So that's why we're trying to find out. And I know you said it's site specific, but is there any way to bulletin this? Or like you said, I mean, you don't want unassigned people to show up, but people want to get vaccinated. There's a huge demand.
And I appreciate that. But here's the key part here is that I'd rather us be having this conversation than us having a conversation about us wasting vaccines.
Right, yeah, sure.
And that second conversation is just absolutely unacceptable. So this is something that it's fine. It's not going to be a perfect process. Yes, it's going to be random chance, and we want it to be random chance because you just don't know when that's going to be. But it's not something to rely on. And just if you're one of these healthier people, just wait. Just wait. Your time will come, and so and as we go through the through the eligibility criteria, and at the rate that we're vaccinating, we are going to start vaccinating the much younger, much quicker than the rest of the country. So we should have some comfort in that, and in that we're we're one of the leaders in the country in terms of our vaccination rates. And because of that, we're making a strong push for the federal government to give us more vaccines because we are actually getting them in arms. Yeah. And so before you know it, Guam and the CNMI is probably going to be a big win for the country because we're likely going to be the first places that are going to achieve herd immunity. And so
that probably will be CNMI.
It's okay. He's biased to CNMI. He's pro CNMI.
Yeah.
Doc, so I mean, you said a couple earlier we're running low on vaccines, but at the same time you said that the way we're just giving everybody the vaccine should make the federal government say, oh, here's some more. Or could it also make them say, oh, you guys have given a lot of vaccines, you're good for now. We got to give some to Rhode Island or wherever.
No, because these other places are just, they're giving to them, but they're just sitting on the shelves.
Okay.
They're sitting in the fridge. So it's the complete opposite. In fact, they're thinking about penalizing certain states for not giving it out more efficiently and holding back their stock and saying, we're going to give it to the states and territories that are actually using them and putting them in arms. And so they do no good sitting in storage, and getting them in arms is the most efficient part. And we are talking to our federal partners here and working every angle to make the argument that please give us more vaccines at a much higher. In fact, we want triple the rate that you're giving it to us. And so right now we already know that they're bumping up our initial allotment, but we may get a lot more after, even in short order.
Doc, is there any update on the homebound vaccinations and the frustrations by village mayors on getting the criteria for
Yeah.
for you have to be bedridden, and now
Yeah.
some of the
Kind of cold, Doc.
Yeah, the
Well,
home.
let me be clear here is that the priority is the bedridden, okay? And I think there's no argument about that, and I think everybody would agree on that. And then, the definition of homebound is based on a criteria about your activities of daily living and whether or not you need assistance with it. And so that criteria has been given to the mayors, I think, as early as last week Friday. And so, but some of them were being very good and being very efficient and trying to get their list set out right away. But now we're asking them to review their list and maybe be certain on which areas that they think are the priorities for not just, of course, the bed bound, but those that are don't have to be bed bound, but they're definitely at higher risk. And so we have a plan where we have the nurses and we're hitting different villages, and we're going, mostly from the south and working our way back up in terms of hitting the homebounds. And so yesterday, 2 days ago, and yesterday, like for example, Zonia was hit by the, I say hit, but where our nurses went out there and vaccinated them, and then they'll be moving down to the south. And there's a schedule, and they're working with the mayors as they go through with that.
So,
and so just. Yeah.
Yeah. So again, so Menemcos that are wheelchair bound, you get up and go to the vaccination clinics.
Here's the thing: if you're going to rely on getting your vaccine as a homebound patient, there's going to be an additional wait, because you're asking us to go house to house here, and with the limited resources that we have. We're only able to do this now because the National Guard has been able to take on more of the vaccination responsibilities for mass vaccination, and so so it's good. So if you want your vaccine sooner, and if you're able to get out of the house and make one of these Eventbrite appointments to go out and do it, then that's your decision. But if you want to get as a homebound, there will likely be some wait time that comes with that.
And so yes, if you're on a wheelchair, go, because you'll get it a lot quicker, right?
If you can do it, then yes.
Yeah.
And if you have somebody that's going to help push you in a wheelchair, then yes.
All right, and Doc, and then also, I think what may have caused a little confusion was when you guys came out with the whole vax plan, you really stressed upon people that you have to get the second dose X amount of days after you get the first dose, right? 21 or whatever. And so now you're saying that there's actually a little bit of a window there, right? Where you can get it.
We've been pretty consistent that one is that we were afraid about what the compliance would be.
Yeah.
Right. And we weren't sure what the compliance was going to be for those coming back for their second dose. And now it's actually clear that it's actually pretty good right now. Right. And so now we're making sure that the messaging, because we've always said that there was going to be a little bit of a window, and now the CDC has been more clear about what that golden window is actually, and where they're saying, again, up to 42 days is there's good data to show that it's still going to be very effective, and there's just limited data after the 42 days.
Yeah, because we had a comment, hoping my second vaccine dosage is available when due and not be overdue. So basically, you guys told everyone in the beginning, you got to get it 21 days after, or else it's no good, just to make people come in.
Yeah.
So the scare tactic.
If we gave too much, how tight are we going to hold the, how big of a target are we going to use here, right? And so if we were afraid that people weren't going to come around the date, then we try to focus on that. But now that we know that people are really doing well, and that there may be issues with supply, because we're not exactly sure when we're going to get our next stock, then we want to ensure that people actually know what the real bullseye actually is, how big it actually is. But the key thing here is that this may all be moot if we get the vaccines, in short order, and then we don't have to ask anyone to wait an additional week. Remember, I personally got mine 1 week later than I was due, and I did that as a personal decision because I was at a busy inpatient rotation, and I didn't want to jeopardize my time doing that. So I wanted to wait until I rotated off service to get it. And so, and that was a personal decision that I made, and I'm very comfortable with it. So I'm not just asking people to do it because, we're asking. I actually did it myself, and I wouldn't ask anybody to do something I wouldn't do myself.
Yeah.
But can you get the vaccine, since if you say that you can get it a week, the second dose a week later, can you get it a week earlier?
So it's about a 4-day buffer in terms of getting it earlier.
So you can get it. You can get it 4 days prior to the 21. So at what date? 19, 18.
Yeah. So that's where there is some buffer, and because there's data that supports that.
Okay.
So
Doc,
is public health, because you're in such a short, you're having issues with the shortage of the vaccine, is public health prioritizing those individuals that meet that 19 day?
When you say, well,
Like
what we're doing
calling them and say, come in and get your second dose. We're in a limited supply.
Yes.
I mean, as opposed to letting friends and family come in.
Oh yeah, absolutely. And so that's where the like, for example, the remaining Pfizers are focused only for second doses, starting today, in fact. And so now only first doses are going to go to Moderna. So those who are getting their first doses will only be getting Moderna. Pfizer won't be available for first doses.
Doc, I know this is going to require us going back a little bit, but Chamarita Regis is a loyal Link listener. She writes here in our Facebook comments, Chris, why is it then why do we have to consult our physician before taking the vaccine?
I think that consulting your physician, in any time that you have any concern is always a good standard recommendation overall. However, this is there's been many physicians that have been going on air and talking about the safety of the vaccine, not just myself. And so, when we're talking about it to more of the general public, if you have multiple medical issues and that you're concerned about getting the vaccine, then yes, absolutely talk to your physician or call the clinic and ask about it. And even a nurse might be able to help discuss with you on a one-to-one basis. But overall, what we know is that there's very little contraindication for getting this vaccine, and that really doesn't matter. When you have the most common chronic conditions like heart disease, hypertension, diabetes, but you are actually the person that we want to ensure that get the vaccine. But right now we're doing it mostly by age criteria. So those should allay a lot of concerns from that have with in terms of, is it gonna, am I somebody that can't get the vaccine because I have X, Y, and Z?
Go ahead.
Go ahead.
No, I wanted to ask from another viewer, is there a plan B should the second dose be delayed, the shipment?
You mean the plan B in terms of
what do we do?
How delayed?
No,
Plan B, because you said we're running low on vaccine and we're asking the feds to give us more. So what if that shipment is delayed, or if the second dose?
Space it out.
Like, let's say you take the vaccine, right, Doc, and then you're supposed to get your second dose, and you miss it. What happens?
Well, we space it out, and again, let me say this. Let me put this other point here. The WHO, the World Health Organization, says that we can even give it up to 4 weeks after your due date. So they're even going even farther and saying in extenuating circumstances, like if we run out and we just can't give it, they're even giving the 4-week window. They're more liberal than the CDC. And so, we should have some faith in that, and that, we've been getting our vaccine allotment no more than a month after the last one. So, we shouldn't expect anything less than that. In fact, we're expecting it much more and more frequently.
Can you explain why bars aren't being allowed to open?
Why bars aren't being allowed to be open?
From the public health standpoint,
I think Chris and Bri, I think you both can answer that question, right? I think we've had that question and we had that discussion multiple times, and I think that it's pretty clear that it's one of the most high risk areas in terms of transmission because of the nature of how people seat themselves, consume beverages and food and socialize, and in the setting where a lot of masks down, a lot of shouting, a lot of talking very close to each other. I mean, that's just a recipe for that's COVID's dream environment.
Are you sure it's not because the governor's mad that they filed a lawsuit?
I think we've been pretty consistent on this, and we have a pretty good track record.
Yeah.
But there are bars that are serving food now, so that they can be allowed to open.
Yeah.
And I drive by this bar in Agana almost every day because I'm in Agana, and I don't see anybody wearing masks outside. And it's because it's outside that it's okay.
Yeah, I mean, Doc,
I even saw a police car there, and the police car left, and it was still open.
It's just, I mean, confusing because you have people going to these quasi-bar restaurants doing exactly the same thing that you're saying is keeping the bars closed. And I don't go to the bar. I don't care. Honestly, I don't care, and I get the risk and stuff. And I feel like so many bars have pivoted and started serving food so they can kind of open on a technicality. And I mean,
I'll just say this. If we continue on the trend that we're doing right now with there's so little community spread, then really there is no argument left and that bars should be able to be open. The question is just let's keep doing this in a stepwise manner. The governor just announced the executive orders that's going to increase social gatherings to 25. And again, this is outside of a restaurant or bar setting, for example. And so this social gathering is going to be extended. And I think it's just a stepwise. We take a step, we assess what happens. It looks good. Take another step, assess what happens. And so I think we've been consistent in that, and that we just don't want to screw this up. Everyone, we're doing so good. Let's not screw it up.
So the reason the bars are remain closed, is based on scientific data.
There's plenty of scientific data throughout the globe about the dangers of transmission within bars or club settings.
Right. Doc, what about the mayors and the mayor's staff vaccination? Where are they in the line? Because it kind of seems like they're out there more than the teachers. I mean, no offense, teachers.
Grocery store workers, gas station attendants.
Yeah, they're in the 1B category, and there is a balance of getting to them. We wanted to allow more of the people with comorbidities and ensure that the people that are 60 and above still get their opportunities to get. So we're trying to make sure that we have that process. Only 19% of those 60 to 74 years old have gotten their first dose. So there's plenty to still vaccinate there. And so we have to balance that with the balance of adding on more 1B category essential workers. And yes, the grocery store workers, for example, are high on the list, and that's probably going to be looked at very closely at the next DAPPC meeting on Monday.
But if they know somebody, they could probably just get a call over to one of the clinics and just go at the end of the day, right?
Yeah, right. Because there's no protocol for the use.
I'm not going to respond to that.
Anything else, Doc?
Yeah, I'm just glad you guys are not. I'm just glad you guys are not yelling at us and berating us because we have spoiled vaccine doses.
No. Yeah, no, and Doc, I mean, it's a valid question to ask. Is that if we
got asked about it.
Yeah.
So I just want to make sure.
And I'm just responding about what I'm happy about.
Yeah.
And also just another follow up on the renal care centers. I know that we had seen one of the Joint Information Center reports that they were being trained to give the vaccines. Has that already started?
Yeah, the training part is fine. From my understanding that they got new refrigerators, and then there's a quality control, quality assurance process that they have to still complete, and in order to meet CDC guidelines. And again, safety and ensuring the safety of the specimens for the patient, but then also that we don't spoil vaccines here. And so that's why a very stringent quality assurance and quality control goes into these providers before they can qualify to be able to get the vaccines. And a lot of clinics and even one pharmacy has already met those requirements, and so that's why they're being given the doses. But and it's just because of these circumstances. But otherwise, the training, as I understand it, has been completed, and so that's not the limiting step.
Let me just
this is same thing that a lot of the other clinics had to go through, and that was part of the wait time, and so that's just that nature.
Doc, can you give us any info on IIAG Sports being approved for this quarter by Public Health? Were they given the approval or not, or is it still out?
I'm not very familiar with that right now, so I won't comment.
Okay.
All right. Thanks, Doc.
Okay. Thank you, everyone. Have a good Friday. Enjoy your weekend.
Have a good weekend, Doc. Appreciate your time.
Take care.
There you go. Dr. Felix Cabrera, the Chief Medical Officer of the Department of Public Health and Social Services. I mean, it is what it is, right? Yeah, of course, we don't want to sit here and talk about, oh, we had to pour the vaccine down the drain. But what we also don't want to happen is everybody's going to get vaccinated because the general public doesn't know that they can go get a vaccination shot
And
because
just-
there's extra ones.
Yeah, and we're hearing now that there's just a limited supply. We don't know when we're going to get our next shipment.
Yeah, so, don't sue us. We're just trying to err on the side of caution, really, because when you got the Chief Medical Officer of Public Health saying we're running low on vaccine, and then it turns out that we're not doing a good enough job of getting people to show up in these priority groups to get vaccinated. That's the bottom line, is public health. We're trying, go get vaccinated, right? So we're doing our part, but for whatever reason, and we heard this the other day, the 60 and up group is not showing up in the numbers that we saw the older group show up in. And so that's why we're asking about the extra vaccine left over at the end of the day. So if and it's happening. So when Dr. Cabrera says don't show up to the vaccination site, I would say show up to the vaccination site. If you want to get vaccinated, if they're just not going to waste vaccines, don't just leave it for the people in the loop who know somebody who can call up, public health nurse hey, guys, how's it? Oh, there's extra. All right, let's go. Mm-hmm. I mean, there should be a protocol or whatever. We're not saying don't give anybody the vaccine, pour it down the drain. We're just saying there should be more of an effort to inform the general public who doesn't fall under the different categories that they have the option. Because it's confusing. We just saw Adeloop, the Guard had put out something like they were giving vaccines for the general public, and then Adeloop came out and said, no, that's not accurate. But it turns out it actually is accurate. So you don't know what the hell, one side of their mouth they say this, the other side of it they say that. It's just a little frustrating. But to turn it into this extreme argument that, what do you want to do? Make us pour the vaccine down the drain? Nobody's saying that. Nobody's saying that. We're just saying if there's a way for people who are not in these categories to get vaccinated, then tell them. Let them know. Don't tell them that it's available, but don't show up. Anyway, at 7:51, we take a really quick break. We're running all kinds of behind here, but we do have from the ACLU, and let me see, Alexa Colby Molinas, who's an attorney with the ACLU, and we also have local attorney Vanessa Williams on to talk about this lawsuit. Like we said, we'll go in with them, find out what it's all about, and then we'll get Polly Microsoft on after to talk about some of the masses that they're having here, as I believe the anniversary for Roe v. Wade was just, it's in January for sure. Forgive me for not knowing, but I'm pretty sure that's why we're seeing on both sides this lawsuit and also the masses for the unborn.